Going to go over some research articles and some X-ray as it pertains to our skeletal system. Okay, as you know, I'm a big fan of spinal health, spinal hygiene, spinal alignment. Your spinal cord is inside of your spine. Your brain communicates to your body and your body to your brain. So if you mess up your spine, you start to infringe upon all of the different systems in your body. So one of the questions I get, a very common question I get in my clinic is, where did this come from? People come in with, a shoulder that's higher on the left, or a hip that's high on the right, or some sort of misalignment. Maybe they have scoliosis, maybe they have a forward head posture, and on it goes. So where does this stuff start? What happens? Well, one answer is it starts at birth. Okay, now does every single child have a birthing issue, pregnancy issue, and that leads to future musculoskeletal dysfunction and so forth? Hard to say. Who knows? But do some? Absolutely. Also, as you grow into your body from the falls and the spills and the accidents and the different things as you're growing up and the different injuries that you sustain, those are also factors that go into musculoskeletal health and the injuries and not injuries and so forth, okay? So everybody's different. Everybody has a different story. But on this one, I do want you to see that mom can contribute to spinal health of the baby. So in utero, there could be some positions that can cause future hip problems, future neck problems, okay? And the abnormal position going through growth and development and or during the birthing process can certainly set that child up for failure later down the road. And unfortunately, this is not something you're going to know or notice until after a while. Maybe when they're 5, when they're 10, maybe not till they're full-blown adult. Another big one is the use of forceps to pull the child out, or forced delivery by just simply grabbing the head and pulling. In A&P2, I go over obstetric, gynecology, birthing process, and so on. And just as a teaser to that, also to let you know a bias of mine, I'm a big fan of natural birth, allowing the mom's body to just do what it's designed to do. I'm not a fan of all the crazy medical intervention that can happen, and I'm talking about unnecessary medical intervention. Inducing labor is typically not a good idea. Epidurals disconnect mom from baby because now you can't feel what's going on. So when there's a disconnect between contraction of the uterus and the way you're supposed to push as baby's coming out, in those intervals and that unique tandem timing that's involved with the birthing process, that's taken away when the birth is rushed, when you're trying to pull the baby out, when things are induced, and so forth. So just keep in mind, I know that what I'm saying here may be new to some of you. The birthing process is, we're taught in our culture to fear it. It's something to fear, and it really isn't. It's very natural. It's very normal. There is a way to go through pregnancy and get educated and learn about your body, about the baby-mom connection, and how to really do this so that you have the best delivery possible for you and your baby, to avoid this kind of stuff. Okay, this is unnecessary. This is very damaging. It hurts the spine, it hurts the skull, it can damage nerves. So again, I get more into that in ANP2 when we get into more of the birthing stuff toward the end of the ANP2 semester. This is your spine from a posterior view. It should be straight. So here's your sacrum. Okay, there's the iliac crest and all the little spinous process all the way up. Okay, over here that's a transverse process on the side. So ideally you want the spine to be straight and in alignment on a posterior view like this. Okay, this picture here is an X-ray showing you scoliosis, so you can see the curvature of the spine, and you can see that one shoulder is lower than the other. So the right shoulder lower, left shoulder is higher. We do have two types of scoliosis. There is functional scoliosis and structural scoliosis. Okay, functional scoliosis is where from a standing position the spine is curved, the scoliosis is curved, but when you bend over it straightens out. That's functional scoliosis. Structural scoliosis is where when you're standing the spine is curved, and when you bend over, like bending over to touch your toes, that kind of bend over, the spine also curves. Okay, so that would be structural scoliosis. And the subluxation patterns that can happen at birth because the head came out, was forced out, forceps, suction cup, whatever, that can misalign the atlas, and of course, medical people aren't trained to look for that kind of stuff. So I do recommend getting your baby, getting their atlas and their spine evaluated for alignment or misalignment patterns and corrected. I've been practicing 12 years now, and I've had a ton of pregnant moms I've taken care of over the years, taking care of them all through their pregnancy. We're educating what to expect, nutrition, exercise, what to expect with the delivery and so forth. And then, I show them these pictures and, that these things can happen. So it's a good idea just to have your newborn checked. And then they get it. After a while they just get it. And they understand this concept of alignment. And they want their child to age into a healthy skeleton. So they bring them in. And sometimes, yes, there are things that are grossly misaligned. And we correct that. And, of course we'll never know this. But what if that kid that they brought in, that newborn that they brought in, who did have an atlas or occiput or some other bone misalignment, that would have gone undetected for a long time, and they would have aged into a spine that could have developed scoliosis, or some other problems that maybe they won't know till they're an adult. Obviously something like that we're never going to know because we corrected it early. Now others, we know that they got hurt because, this history is, they were a forceps birth baby, and, all these problems happened, and all these skeletal problems and these cranial problems happened, post forceps delivery. So granted, you want to try to avoid as much trauma during delivery as you can, and then have the newborn's spine checked, and you could possibly prevent scoliosis from happening. Okay, other things that can contribute to spinal misalignment is the way that we treat ourselves ergonomically. carrying packs like this day after day can misalign the spine. Your muscles start to adapt to the asymmetry of the weight on the right side, nothing on the left. In this example, of course, it could be the other way. The weight can be on your left side and nothing on the right. Just depends on how you carry your tote bag or your purse or whatever. Okay, so on this one, what I recommend is you do if you're going to do a tote bag, do the cross where the bag is this way. Okay, or if you prefer the other way, go like that. I also recommend to, when you're walking to class or walking to your office or walking wherever, carry it on the right side, and when you return, carry it on the left. Trade sides. Okay, when abnormal movement sets into the vertebra, then you're going to start to get decreased oxygen, decreased nutrients, and decreased good stuff that gets to the area. And you're going to get a buildup of byproducts that aren't going to leave very well. That's what happens when abnormal movement sets in. Now, as you can see here in this lateral view of the spine, so here's the vertebra, disc, vertebral body, disc. The blue you're seeing are veins. They've removed the red, which would represent arteries, but what I want you to see is that there's a massive amount of blood supply to the tissue. And here's a superior view. You can see lots of blood supply. Here's the spinal cord within the canal and the bony surrounding. Lots of blood. So when degeneration sets in, arthritic changes, and other problems, one of the things that you can rest assured is there is aberrant movement, abnormal movement, subluxation patterns, and that abnormal movement prevents the good stuff from getting in and the bad stuff from leaving. So over time, you start to develop problems. Okay, here we're seeing the nucleus pulposus, which, a while back we looked at the proteoglycans that are inside of this area that have an affinity for water, so the discs like to stay hydrated. Misalignment patterns will start to dehydrate the disc, and that can lead to disc degenerative disease and other back problems. You're also seeing the blood supply. So the red, these are the arteries, seeing how blood is innervating and allowing all that good stuff that comes with blood, oxygen, nutrients, and so forth in. And look over here. So lactic acid, glucose, oxygen. If there's abnormal movement, you can start to get a buildup of your metabolites, buildup of the pH can change, acidity can set in, and so forth. So spinal health, very important. And if you're wondering, well, what can I do to have a healthy spine? Well, it's very simple. Diet and lifestyle. Lack of movement hurts the spine, so move as much as you can throughout the day and throughout your life. Exercise is important. A sedentary lifestyle, sitting all the time, will hurt you in the long run. Try to do the best you can to consume good foods, anti-inflammatory foods, and foods that are good for your disc and your spine and tissue and growth and repair. And tune-ups. I call them tune-ups. That's where you go in and you get your spine checked and make sure things are in alignment. If it's not, get it aligned. Keep it healthy and maintain that throughout your life. Spinal hygiene, which really is nervous system hygiene. You take care of your nervous system, it will take care of you. Remember that article we looked at, Spine Journal? 2005. Abnormal spine positions and posture lead to adverse health. Pain goes up. Health scores get worse over time. So take care of it. And those things I just recommended are some of the easiest and best ways to do that. Okay, here's an anterior view of the pelvis. Okay, here's your sacrum. This is the pelvis. The os coxa here. There's the femur head. There's your obturator foramen. Okay, the pubis and pubic symphysis. Iliac crest. Now you're noticing that the lumbar spine here is curved. Now that should be straight, but we're seeing a curve here. And to go over some more anatomy, here's your transverse process there. Transverse process. These white lines that you see, that's the spinous process of each vertebra. These two white circles that look like owl eyes looking at you, it's the pedicle. Those are pedicles. Here's your rib. So there's rib 12. So if that's rib 12, then what bone is that? That would be thoracic number 12. And watch this. There's L1, L2, L3, L4, and L5, and then sacrum. Okay? Rib 12, floating rib, articulates with thoracic number 12. Alright, so what I want you to see here is the curvature, the misalignment in the lumbar spine. Look at this femur head, and then look at this one. Notice there's a difference in leg length. Okay, so this person, this is congenital, that has given them this curvature and so forth because they have a leg length inequality. Still fixable, you can still adjust them, do your PT, rehab, and then you put a lift in the short leg to try to make the femur heads more 50-50. Now this one is very obvious, okay? Here's femur head in the acetabulum, femur head in the acetabulum. Look at this, very, very low on the right side, very high on the left. Okay, this is a congenital issue where one leg is longer than the other, creating the hip and iliac crest misalignment, which is then creating a lumbar misalignment. Okay, now this one's pretty aggressive, so they're probably going to have a special shoe made where the sole itself is thick. If the leg length inequality is within a certain measurement, you can put the insert inside the shoe. If it's too big of a leg length difference, then you have to build it into the sole. Okay, now look at this picture, this X-ray. This is a lateral X-ray of the lumbar spine. And then look at this one. Okay, I'm going to keep toggling back and forth. All right, let's go over some things here. Lateral lumbar spine, sacrum, disc space. This is L5 disc, L5 vertebral body, L4 disc, L4 vertebral body, L3 disc, and L3 vertebral body, and so on as you go up the spine. Okay, this hole here is the intervertebral foramen, the IVF. This is very important structure because your nerve root comes out of this. Nerve root comes out of this hole, the foramen hole, intervertebral foramen. There's another IVF, intervertebral foramen, and another one. Okay. Also look at the lordotic curve. Very nice lordotic curve. Remember, that's our secondary curve, also known as the lordotic curve. And just as a reminder, we also have our primary curve, also known as the kyphotic curve, found in the thoracic, spine, and sacrum. Lordotic curve in a mature skeleton found in cervical spine and lumbar spine. So this is a good looking spine. This is what you want. Okay. All right, back here, here's your spinous process. There's a spinous process. Okay, there's one there, spinous process. Okay, I'm going to get a little fancy on you. This right here, that's your superior articulating process. And then the inferior articulating process. Now, you'll have to know this for lab. Maybe by now you've gone over that. If not, you certainly will. But down here, there's the superior articulating process and the inferior articulating process. Okay. All right, so let's go to this one. Notice a difference. Okay, this one is straight, so the lordotic curve is lost. Look at the disc height. The disc is very thin. Now let's go back to the other one. Good looking disc. Good looking lordotic curve. Okay. Loss of disc height. Loss of disc height. Loss of disc height. Loss of disc height. Also, you're seeing spurs. These are spurs that are developing on the end plates of the vertebral body here. There it is again, more spurs. That's evidence of arthritis. So this person has disc degenerative disease and osteoarthritis. Loss of their lordotic curve. There's encroachment of the IVFs on the nerve root, because when you lose disc height, you're going to start to quote and unquote pinch nerve roots. Okay, there's going to be infringement there. This hurts. This is low back pain. And there's a really good chance that this person did nothing within their lifetime and just lived with it. Painkillers, because this is the evidence. This is the things that happen when you do nothing to take care of yourself. This does not happen overnight. It does take time to develop, but sooner or later it's going to catch up with you. Okay, I see it all the time in my clinic. And of course, once people, we get the X-rays and we start diving in, they'll admit, yeah, should have done something about this a long time ago. When I was 20 years old, low back pain, doubled over. I was in bed for a week. They took ibuprofen just to feel better, but eventually, yeah, they get used to the pain and some of the function comes back on its own. It's tolerable, but the underlying wear and tear is still there year after year, decade after decade. Now they're in their 50s or 60s, and then boom, degenerative disease, radiculopathies, low back pain, debilitating issues because they did nothing to take care of themselves. Okay, cervical spine. So here's your jaw. So here's the mandible. You can see teeth there. Here's the occiput. So that's the skull. First bone in the neck is atlas. Second bone in the neck is axis, or C2, C3, C4, C5, C6, C7. Okay. If you look closely here, you do not see a cervical lordotic curve. In fact, this one is going the other way. This is a kyphotic reverse cervical curve. Not good. Body is not happy. This produces lots of pain. All these posterior structures, the ligaments, the muscles, and so forth, they're pulled out of position because of the reverse cervical curve. This tethers the spinal cord. Your spinal cord is in the vertebral canal there, and this is very hard on the nervous system, and it hurts. The evidence is usually neck pain, headaches, weakened immune system, can't sleep well, tightness, trigger points. It can even cause blurred vision. It can cause TMJ issues. People they live like this. They just take ibuprofen all the time rather than getting this corrected. They just live with it. Now let's look at what happens right here. There's arthritis, spurs starting to develop, loss of disc height. Okay, notice that this is the area of greatest subluxation pattern, which means that one's going to wear out quicker because that's the area of the greatest stress. Okay, now let's look over here. Another reverse cervical curve. Now this one, as far as degeneration, is being caught early. So look at disc height. Okay, and no evidence of spurs forming yet, like you can see on this side. There's C1, C2, C3, 4, 5, 6, and 7. Okay. So this neck is going the other way. Now, same thing applies. Now, this person will have neck pain, likely have headaches, and all the usual suspects that comes with, your neck pain and misalignments and forward head posture and so forth. Now, based on the way the X-ray looks, we're catching things early. Now, let's say that they did nothing for 30 years. Okay, then you take an X-ray 30 years from now, you're going to see significant loss of disc height and lots of arthritic changes. However, if they get that corrected, they will age into a healthy spine, a healthy skeleton, a healthy, happy nervous system. And they won't have all those crappy problems that you get when you're older. Okay. All right, here's a cervical curve, the lordotic curve that you want. So here's the occiput. Seeing a little bit of the jaw there. So there's atlas, C1, C2, C3, C4, C5, C6, C7. Here's your spinous process on the posterior aspect of the vertebra. Spinal cord inside the vertebral canal there. It likes this. This is what the body wants. Is a lordotic cervical spine, a kyphotic thoracic spine, a lordotic lumbar spine, and a kyphotic sacral spine. The spinal cord, the cerebrospinal fluid, and everything that's in there, happy with this. Okay. All right. Cervical spine. Okay, you can see this is relatively straight. You can also see the misalignment patterns. These are subluxation patterns leading to arthritic changes and bone spurs and loss of disc height, disc degenerative disease. This side even worse. Tremendous loss of disc height, which means encroachment on the IVFs, on the nerve roots. So this person risks radiculopathies going down one arm or the other. Since this is the neck, the nerves that come out of the neck go down the arm. If it's in your low back, those nerves come out of the lumbar spine and go down your legs. So here's atlas, okay, C1, C2, and so on. And a flattening of the cervical spine here. So the loss of lordotic curve, arthritis, and degeneration. Painful. And there's a good chance that it was like this a long time ago, 20, 30, 40 years ago, and did nothing about it. And now they're sick of it. They come in, and there you have it. Okay, a spondylolisthesis. I do want you to know this term. Spondylolisthesis is a forward slippage of the vertebra. Okay, so here's sacrum. Now this is a misalignment pattern. It's a pretty aggressive misalignment pattern where in this case, the L5 vertebra slips forward, an anterior slippage called a spondylolisthesis. Okay. Here's a picture of it. So it's very hard on the disc and hard on the nerve roots. Okay, this one happened because of a fracture, looks like through the pedicle there. And once you get a spine fracture like that, one of the side effects can be a spondy. That's the slang for this, is a spondy or spondylolisthesis. Okay, now not much you can do about this, meaning you cannot really put it back into place. But what you can do is through the PT rehabs and adjustments is maintain what you have left and prevent it from slipping further over time. In some cases you can move it, recenter it a little bit, but something this aggressive, which is more than about halfway down the sacrum as far as slippage is concerned, Not really going to get it 100% back, but you can get some improvement. But the key in this case is to maintain. Surgeons really don't do surgery on spondies unless it's really, really bad and compromising a lot of neurological problems. Otherwise, they just leave them alone, and they recommend PT and rehab and so forth. Okay, degeneration. Look at this. Here's the spinal cord. Okay, this is an MRI. This is your spinal cord. And here's the vertebra. Okay, the dark black you're seeing there, that is the disc space. The light gray box looking things, that's the vertebra. The white that you're seeing in here, that is the cerebrospinal fluid. Here's the posterior elements, like your spinous process, ligamentum nuchae back here. Seeing a little bit of brain stem up in this area. So this is a tethered cord. So those x-rays we looked at, this is what the heck is going on MRI. So now you can see for yourself, you are tethering the cord. It's hard on the CSF, cerebrospinal fluid. It's hard on the spinal cord. And now that article we looked at, Spine Journal, talking about as the spine goes out of place, health gets worse because you are choking, hurting your nervous system. Okay, now look at this area. See that little bulge there? That's a herniation, disc bulge, pressing on spinal cord. Not fun. Person's not happy. This is very painful. Another disc bulge there. So earlier when we looked at disc and disc nutrition, or health for your disc, abnormal movement is going to lead to degeneration and herniations and disc bulges and all that. And that's what's going on here. Straight neck. Okay, flattening of the cervical spine. Evidence of arthritic changes and loss of disc height. And if you really want to see this, look at this. See this right here? See how that disc has a little bit of light gray in it? See how this is very black? That is letting you know it's dehydrated. There's nothing in there. So it's going to get hurt because all those nutrients coming in and the waste products leaving, that damage has been done. Okay? Now you can still help these people. They can still get tremendous relief through the adjustments in PT and rehab, spinal decompression, dry needling, and all the cool things that we do. So they can still get help. But what's better is to not let it get to this level. Okay? And so over here, here's what the x-ray would look like. A degenerative x-ray. So nasty. Look at that right there. Extreme loss of disc. This is almost autofusion, where one bone fuses itself to another. Very, very thin disc. Okay, lots of arthritis and osteophytes throughout the spine. Loss of cervical curve. Okay, forward head posture. They just let this go too long. Just lived with the pain, lived with the dysfunction. Okay, same thing with your lumbar spine. So here's an MRI of your lumbar spine. You're seeing the disc. Okay, that black stuff there, that's the disc. The light gray boxy looking things is your vertebra. This is sacrum down here. Okay, there's your spinal cord canal area. Look at this bulge. There's a herniation there, pressing on sensitive nerve structures. There's a bulge there, pressing on sensitive nerve structures. The low back, the L5, L4, receive a lot of biomechanical stress because of the weight of your body, gravity, and so on. Sitting very hard on the disc. So just over time, this stuff starts to happen. Okay, you're seeing a flattening of the lumbar spine there. So a loss of lordotic curve. Now we can still help them. This is very common. This is why people come in to a clinic like mine, because they have back pain, low back pain. That's what we do. Deal with that kind of stuff. Now over here, you're seeing an animation of what that degeneration looks like. Okay, all of these osteophytes, which is basically excessive calcium and other mineral deposits over time. on the bone. Disc is basically gone, nerves infringed upon, so very unhealthy spine, lumbar spine. Okay, the annular fibers and nucleus pulposus, I do want you to know this, where the annular fibers are these rings that are on the outside of your disc. Okay, so this is a superior view of the lumbar spine or vertebra. There's the nucleus pulposus, the material in the middle. Now you're starting to see tears. You're seeing tears in the annular fibers, and eventually this nucleus is going to start to leak out, as you're seeing over here. So it starts to bulge or leak out, pressing on nerve root structures, very sensitive. So since this is a lumbar spine, this will shoot pain down the leg typically. You're seeing a tear, annular fiber tear, and the nucleus is starting to bulge and herniate. Okay. So one way to prevent this, or several ways to prevent this, is diet and lifestyle. Movement. Discs love movement. They hate not movement. No moving. Sedentary. Excessive sitting, and so forth. Okay, that is a fast track route to degeneration. Eat good foods. Keep yourself hydrated. Keep your core strong. Okay, we're going to look at some articles later about low back pain and core strengthening and atrophy of muscles and so forth. Okay, so I do want you to know what the annular fibers are, what the nucleus pulposus is, and then what a herniation is. And that's when the nucleus starts to leave. They typically leave posterior and lateral, as you're seeing here, and this is a herniation. When a herniation happens, depending on the level, it depends on where you're going to feel it. So let's say it's right there, you're going to feel it down the leg. Okay, we're going to dive into this when we get to the nervous system. We're going to hit peripheral nerves pretty hard, and nerve root patterns and dermatome patterns and things like that. Okay, but for right now, just want you to know that nerves do come out of your spine and innervate different parts of your body, and if you get a herniation that presses on one of these sensitive nerve root structures, you're going to feel it down the length of that nerve. Okay, so it could be as long as all the way down to your foot, your so-called sciatica.